Hello, good evening. My name is Victoria Vinader, and I am the Research Manager at the Bone Cancer Research Trust. Tonight, we are presenting some case studies which are based on examples that patients have shared with us. Please note that the outcomes we are presenting are current, that is, as in October 2021. The first example is a 46-year-old female patient that was diagnosed with ameloblastoma. She was actually in pain for 3 years before her diagnosis. Her initial symptoms were mostly an earache and some tenderness and difficulty in chewing. She also developed a lump that appeared at the back of her teeth about a year and a half before her diagnosis. She visited her GP many times because of the earache, and she was given antibiotics, assuming it was an abscess, and no x-ray were taken. Eventually, she went to an emergency dentist who suggested that she had a cyst, and she was sent back to her normal dentist. She went back to her dentist, who referred her to their local dental hospital. Remember that at this point, everyone is assuming that she had an impacted wisdom tooth. At the hospital, an x-ray was taken that showed a tumor mass and some bone destruction, and a biopsy was taken, and she was diagnosed with ameloblastoma. The treatment was surgery, and a very significant surgery, where half her right mandible and soft tissue in her mouth was replaced with bone from her fibula, and skin, muscle, and blood vessels from her leg. And everything was put together with titanium plates and screws. She had a second operation to improve the look of her new mouth and particularly her tracheostomy scar. And the patient is well. You can see from her quote here that one of the long-lasting problems is that she will need a soft eye for the rest of her life. The second case is also an ameloblastoma, but it's slightly different. The initial symptoms were problems chewing and an uneven bite. The patient had a pretty straightforward diagnostic journey. She went to her dentist, who referred her to a dental hospital. She had a biopsy and was diagnosed with ameloblastoma. She underwent surgery to remove the tumor and the surrounding tissue around the jaw and replacing the lost bone with some bone from her hip. And she went back to normal with regular checkups for 10 years. However, during a regular dental appointment, she had a routine x-ray, which was followed by another visit to the dental hospital and another biopsy, and the tumor had returned. She underwent surgery again to remove the tumor, and here you can see an x-ray before. You can just see here the tumor mass, and the tumor was removed and was fixed with a bone graft, which was held together with titanium plate and screws. You can just see them here. She had a good outcome, and she is back to normal with regular checkups. The two examples I have presented are from ameloblastoma tumors. These are aggressive but not malignant bone tumors. The next examples are cancerous tumors. A 26-year-old female patient was diagnosed with osteosarcoma. Her initial symptoms was a swollen gum, which you can just see here in the photograph, and a little bit of tingling on the outside of her face. She had a pretty straightforward diagnostic journey. She visited her dentist 3 times, and she was referred to her local maxillofacial unit. She had a dental cone beam CT scan and a biopsy, and she was diagnosed with osteosarcoma. Her treatment involved 10 weeks of chemotherapy, followed by a very significant surgery where the left mandible was replaced with bone from her fibula and obviously tissue from around her leg, followed by 18 weeks of chemotherapy. Although she had a straightforward diagnostic journey, her treatment was very problematic, and indeed she suffered, for example, from sepsis and lots of other problems. The outcome is that the patient is now in remission, although she is closely monitored, and she will still need dental reconstruction. The second osteosarcoma case is of an 18-year-old female patient. Her initial symptoms were simply a small abscess on her gum. She went to her dentist, who also noticed that her front tooth was moving at a slightly peculiar angle. But at that point, her lump wasn't growing and it wasn't actually painful. The dentist took an X-ray, and although everything seemed normal, was slightly concerned, so referred her to a maxillofacial hospital. While she was awaiting the appointment to come through to the hospital, she went back to her GP to inform them of her visit to the dentist and her referral. The GP thought it was actually an abscess and prescribed her antibiotics that she should take for a couple of weeks until it was cleared. She eventually went to the hospital, and by then the growth had become much larger and painful. They took a biopsy, they did blood tests, CT scans, X-rays, and everything seemed clear. But that didn't make sense because her lump was really growing. So an operation to harvest a larger sample for biopsy was scheduled, and she was diagnosed with osteosarcoma. She underwent chemotherapy for 7 months, followed by a really significant operation where she had a large portion of her cheek removed and her lip and the whole of her upper jaw removed. And in total, the patient had 3 operations. The first one to remove the tumor, the second to incorporate some muscle and skin from her back onto her face, and the third to improve slightly the look of the previous surgeries. She is well, but still needs to undergo reconstruction. The last case study is of a 6-year-old boy who was diagnosed with metastatic Ewing sarcoma. Initially, the patient complained of chest pain, and his parents really assumed it was a pull muscle because he was a 6-year-old and he was like a, very active boy. So they took it to his GP. Again, the GP assumed it was muscle related and simply advised ibuprofen, which improved the situation. But 2 months later, he complained of pain in his jaw, which got worse, particularly at night. And to be fair, neither the GP or the parents connected the 2 events together, and you wouldn't blame them because they don't seem connected at all. They visited their GP many times after, and this didn't really result in anything. An ear infection that was treated with antibiotics, temporomandibular disorder, and even teething. Blood tests were taken and they were inconclusive. And one weekend, the boy was in so much pain that his parents took him to an emergency dentist who did take an X-ray. Didn't find anything, however, noticed a little bit of swelling around his temple and advised them to take him to a hospital to see a maxillofacial specialist. They did so, and after scans and biopsy, he was diagnosed with metastatic Ewing sarcoma in his skull, chest wall, and spine, with small metastatic nodules in his lungs. At the moment, we still do not know where the tumor started. He underwent 8 weeks of chemotherapy, followed by 6 weeks of daily radiotherapy sessions. During his treatment, he had many blood and platelet transfusions. And because the location of the tumor in the skull and the spine, he was actually not able to undergo surgery. The outcome is fabulous. He is well, and he only suffers from severely dry eyes. And he has his scans now every 3 months, which had been moved from initially MRI and CT scans to now just MRI and X-rays on the chest. This is really brilliant news, but it does cause a lot of anxiety to his family. Thank you. I hope you found this informative. I am very happy to answer any questions you may have now or perhaps later. If you want to get in touch with us, please email us at research@bcrt.org.uk. Thank you very much.